Pediatric nursing 2. Question 1. Andrea with suspected rheumatic fever is admitted to the pediatric unit. When obtaining the child's history, the nurse considers which information to be most important. A. A fever that started 3 days ago. B. Lack of interest in food. C. A recent episode of pharyngitis. D. Vomiting for 2 days. Answer: C. A recent episode of pharyngitis is the most important factor in establishing the diagnosis of rheumatic fever. Although the child may have a history of fever or vomiting or lack interest in food, these findings are not specific to rheumatic fever. Question 2. Nurse Liza is administering a medication via the intraosseous route to a child. Intraosseous drug administration is typically used when a child is A. Under age 3. B. Over age 3. C. Critically ill and under age 3. D. Critically ill and over age 3. Answer: C. In an emergency, intraosseous drug administration is typically used when a child is critically ill and under age 3. Question 3. When assessing a child's cultural background, the nurse in charge should keep in mind that A. Cultural background usually has little bearing on a family's health practices. B. Physical characteristics mark the child as part of a particular culture. C. Heritage dictates a group's shared values. D. Behavioral patterns are passed from one generation to the next. Answer: D. A family's behavioral patterns and values are passed from one generation to the next. Cultural background commonly plays a major role in determining a family's health practices. Physical characteristics do not indicate a child's culture. Although heritage plays a role in culture, it does not dictate a group's shared values, and its effect on culture is weaker than that of behavioral patterns. Question 4. While examining a 2-year-old child, the nurse in charge sees that the anterior fontanel is open. The nurse should A. Notify the doctor. B. Look for other signs of abuse. C. Recognize this as a normal finding. D. Ask about a family history of Tay-Sachs disease. Answer: A. Because the anterior fontanel normally closes between ages 12 and 18 months, the nurse should notify the doctor promptly of this finding. An open fontanel does not indicate abuse and is not associated with Tay-Sachs disease. Question 5. The nurse is aware that the most common assessment finding in a child with ulcerative colitis is A. Intense abdominal cramps. B. Profuse diarrhea. C. Anal fissures. D. Abdominal distension. Answer: B. Ulcerative colitis causes profuse diarrhea, intense abdominal cramps, anal fissures, and abdominal distensions are more common in Crohn's disease. Question 6. When administering an IM injection to an infant, the nurse in charge should use which site? A. Deltoid. B. Dorsogluteal. C. Ventrogluteal. D. Vastus lateralis. Answer: D. The recommended injection site for an infant is the vastus lateralis or rectus femoris muscles. The deltoid is inappropriate. The dorsogluteal and ventrogluteal sites can be used only in toddlers who have been walking for about 1 year. Question 7. A child with a poor nutritional status and weight loss is at risk for a negative nitrogen balance. To help diagnose this problem, the nurse in charge anticipates that the doctor will order which laboratory test? A. Total iron binding capacity. B. Hemoglobin. C. Total protein. D. Serum transferring. Answer: C. A negative nitrogen balance may result from inadequate protein intake and is best detected by measuring the total protein level. Measuring total iron binding capacity, hemoglobin, and serum transferring levels would help detect iron deficiency anemia, not a negative nitrogen balance. Question 8. When developing a plan of care for a male adolescent, the nurse considers the child's psychosocial needs. During adolescence, psychosocial development focuses on A. Becoming industrious. B. Establishing an identity. C. Achieving intimacy. D. Developing initiative. Answer: B. According to Erickson, the primary psychosocial task during adolescence is to establish a personal identity. Confusion. The adolescent attempts to establish a group identity by seeking acceptance and approval from peers, and strives to attain a personal identity by becoming more independent from the family. Becoming industrious is the developmental task of the school-aged child, achieving intimacy is the task of the young adult, and developing initiative is the task of the preschooler. Question 9. When developing a planned care for a hospitalized child, Nurse Micah knows that children in which age group are most likely to view illness as a punishment for misdeeds. A. Infancy. B. Preschool age. C. School age. D. Adolescence. Answer: B. Preschool-age children are most likely to view illness as a punishment for misdeeds. Separation anxiety, although seen in all age group, is most common in older infants. Fear of death is typical of older school-age children and adolescents. Adolescents also fear mutilation. Question 10. Nurse Taylor suspects that a child, age 4, is being neglected physically. To best assess the child's nutritional status, the nurse should ask the parents which question? A. Has your child always been so thin? B. Is your child a picky eater? C. What did your child eat for breakfast? D. Do you think your child eats enough? Answer: C. The nurse should obtain objective information about the child's nutritional intake, such as by asking about what the child ate for a specific meal. The other options ask for subjective replies that would be open to interpretation. Question 11. A female child, age 2, is brought to the emergency department after ingesting an unknown number of aspirin tablets about 30 minutes earlier. On entering the examination room, the child is crying and clinging to the mother. Which data should the nurse obtain first? A. Heart rate, respiratory rate, and blood pressure. B. Recent exposure to communicable diseases. C. Number of immunizations received. D. Height and weight. Answer: A. The most important data to obtain on a child's arrival in the emergency department are vital sign measurements. The nurse should gather the other data later. Question 12. A mother asks the nurse how to handle her 5-year-old child, who recently started wetting the pants after being completely toilet trained. The child just started attending nursery school 2 days a week. Which principle should guide the nurse's response? A. The child forgets previously learned skills. B. The child experiences growth while regressing, regrouping, and then progressing. C. The parents may refer less mature behaviors. D. The child returns to a level of behavior that increases the sense of security. Answer: D. The stress of starting nursery school may trigger a return to a level of successful behavior from earlier stages of development. A child's skills remain intact, although increased stress may prevent the child from using these skills. Growth occurs when the child does not regress. Parents rarely desire less mature behaviors. Question 13. A female child, age 6, is brought to the health clinic for a routine checkup. To assess the child's vision, the nurse should ask: A. Do you have any problems seeing different colors? B. Do you have trouble seeing at night? C. Do you have problems with glare? D. How are you doing in school? Answer: D. A child's poor progress in school may indicate a visual disturbance. The other options are more appropriate questions to ask when assessing vision in a geriatric patient. Question 14. During a well baby visit, Jenny asks the nurse when she should start giving her infant solid foods. The nurse should instruct her to introduce which solid food first? A. Applesauce. B. Egg whites. C. Rice cereal. D. Yogurt. Answer: C. Rice cereal is the first solid food an infant should receive because it is easy to digest and is associated with few allergies. Next, the infant can receive pureed fruits, such as bananas, applesauce, and pears, followed by pureed vegetables, egg yolks, cheese, yogurt, and finally, meat. Egg whites should not be given until age 9 months because they may trigger a food allergy. Question 15. To decrease the likelihood of bradyarrhythmias in children during endotracheal intubation, succinylcholine-induced is used with which of the following agents? A. Epinephrine adrenaline. B. Isoproterenol isoprol. C. Atropine sulfate. D. Lidocaine hydrochloride xylocaine. Answer: C. Succinylcholine is an ultra-short-acting depolarizing agent used for rapid sequence intubation. Bradycardia can occur, especially in children. Atropine is the drug of choice in treating succinylcholine-induced bradycardia. Lidocaine is used in adults only. Epinephrine bolus and isoproterenol are not used in rapid sequence intubation because of their profound cardiac effects. Question 16. A 1-year and 2-month-old child weighing 26 pounds 11.8 kilograms is admitted for traction to treat congenital hip dislocation. When preparing the patient's room, the nurse anticipates using which traction system? A. Bryant's traction. B. Box extension traction. C. Overhead suspension traction. D. 90/90 traction. Answer: A. Bryant's traction is used to treat femoral fractures of congenital hip dislocation in children under age 2 who weigh less than 30 pounds 13.6 kilograms. Bucks extension traction is skin traction used for short-term immobilization or to correct bone deformities or contractures. Overhead suspension traction is used to treat fractures of the humerus, and 90/90 traction is used to treat femoral fracture in children over age 2. Question 17. Mandy, age 12, is 7 months pregnant. When teaching parenting skills to an adolescent, the nurse knows that which teaching strategy is least effective. A. Providing a one-on-one demonstration and requesting a return demonstration, using a live infant model. B. Initiating a teenage parent support group with first and second-time mothers. C. Using audio-visual aids that show discussions of feelings and skills. D. Providing age-appropriate reading materials. Answer D, because adolescents absorb less information through reading. Providing age-appropriate reading materials is the least effective way to teach parenting skills to an adolescent. The other options engage more than one of the senses and therefore serve as effective teaching strategies. Question 18. When performing a physical examination on an infant, the nurse in charge notes abnormally low-set ears. This findings is associated with A. Otogenous tetanus. B. Tracheoesophageal fistula. C. Congenital heart defects. D. Renal anomalies. Answer D. Normally the top of the ear lines with an imaginary line drawn across the inner and outer canthus of the eye. Ears set below this line are associated with renal anomalies or mental retardation. Low-set ears do not accompany otogenous tetanus, tracheoesophageal fistula, or congenital heart defects. Question 19. Nurse Raven should expect a 3-year-old child to be able to perform which action? A. Ride a tricycle. B. Tie the shoelaces. C. Roller skates. D. Jump rope. Answer A. At age 3, gross motor development and refinement in eye-hand coordination enable a child to ride a tricycle. The fine motor skills required to tie shoelaces and the gross motor skills required for roller skating and jumping rope develop around age 5. Question 20. Nurse Bettina is teaching a group of parents about otitis media. When discussing why children are predisposed to this disorder, the nurse should mention the significance of which anatomical feature. A. Eustachian tubes. B. Nasopharynx. C. Tympanic membrane. D. External ear canal. Answer A. In a child, eustachian tubes are short and lie in a horizontal plane, promoting entry of nasopharyngeal secretions into the tubes and thus setting the stage for otitis media. The nasopharynx, tympanic membrane, external ear canal have no unusual features that would predispose a child to otitis media. Question 21. The nurse is evaluating a female child with acute post-streptococcal glomerulonephritis for signs of improvement. Which finding typically is the earliest sign of improvement? A. Increased urine output. B. Increased appetite. C. Increased energy level. D. Decreased diarrhea. Answer A. Increased urine output, a sign of improving kidney function, typically is the first sign that a child with acute post-streptococcal glomerulonephritis is improving. Increased appetite, and increased energy level, and decreased diarrhea are not specific to IPSN. Question 22. Dr. Smith prescribes corticosteroids for a child with nephritic syndrome. What is the primary purpose of administering corticosteroids to this child? A. To increase blood pressure. B. To reduce inflammation. C. To decrease proteinuria. D. To prevent infection. Answer: C. The primary purpose of administering corticosteroids to a child with nephritic syndrome is to decrease proteinuria. Corticosteroids have no effect on blood pressure. Although they help reduce inflammation, this is not the reason for their use in patients with nephritic syndrome. Corticosteroids may predispose a patient to infection. Question 23. Parents bring their infant to the clinic, seeking treatment for vomiting and diarrhea that has lasted for 2 days. On assessment, the nurse in charge detects dry mucous membranes and lethargy. What other findings suggests a fluid volume deficit? A. A sunken fontanel. B. Decreased pulse rate. C. Increased blood pressure. D. Low urine-specific gravity. Answer: A. In an infant, signs of fluid volume deficit dehydration include sunken fontanels, increased pulse rate, and decreased blood pressure. They occur when the body can no longer maintain sufficient intravascular fluid volume. When this happens, the kidneys conserve water to minimize fluid loss, which results in concentrated urine with a high specific gravity. Question 24. How should the nurse may prepare a suspension before administration? A. By diluting it with normal saline solution. B. By diluting it with 5% dextrose solution. C. By shaking it so that all the drug particles are dispersed uniformly. D. By crushing remaining particles with a mortar and pestle. Answer: C. The nurse should shake a suspension before administration to disperse drug particles uniformly. Diluting the suspension and crushing particles are not recommended for this drug form. Question 25. What should be the initial bolus of crystalloid fluid replacement for a pediatric patient in shock? A. 20 ml/kg. B. 10 ml/kg. C. 30 ml/kg. D. 15 ml/kg. Answer: A. Fluid volume replacement must be calculated to the child's weight to avoid overhydration. Initial fluid bolus is administered as 20 ml/kg, followed by another 20 ml/kg bolus if there is no improvement in fluid status. Question 26. Becky, age 5, with intelligence quotient of 65 is admitted to the hospital for evaluation. When planning care, the nurse should keep in mind that this child is A. Within the lower range of normal intelligence. B. Mildly retarded but educable. C. Moderately retarded but trainable. D. Completely dependent on others for care. Answer: B. According to the American Association on Mental Deficiency, a person with an intelligence quotient IQ between 50 and 70 is classified as mildly mentally retarded but educable. One with an IQ between 35 and 50 is classified as moderately retarded but trainable. One with an IQ below 36 is severely and profoundly impaired, requiring custodial care. Question 27. Maureen, age 12, is brought to the clinic for evaluation for a suspected eating disorder. To best assess the effects of role and relationship patterns on the child's nutritional intake, the nurse should ask: A. What activities do you engage in during the day? B. Do you have any allergies to foods? C. Do you like yourself physically? D. What kinds of food do you like to eat? Answer: C. Role and relationship patterns focus on body image and the patient's relationship with others, which commonly interrelated with food intake. Questions about activities and food preferences elicit information about health promotion and health protection behaviors. Questions about food allergies elicit information about health and illness patterns. Question 28. Sudden infant death syndrome (SIDS) is one of the most common causes of death in infants. At what age is the diagnosis of SIDS most likely? A. At 1 to 2 years of age. B. At a week to 1 year of age, peaking at 2 to 4 months. C. At 6 months to 1 year of age, peaking at 10 months. D. At 6 to 8 weeks of age. Answer: B. SIDS can occur any time between 1 week and 1 year of age. The incidence peaks at 2 to 4 months of age. Question 29. When evaluating a severely depressed adolescent, the nurse knows that one indicator of a high risk for suicide is: A. Depression. B. Excessive sleepiness. C. A history of cocaine use. D. A preoccupation with death. Answer: D. An adolescent who demonstrates a preoccupation with death, such as by talking about death frequently, should be considered at high risk for suicide. Although depression, excessive sleepiness, and the history of cocaine use may occur in suicidal adolescents, they also occur in adolescents who are not suicidal. Question 30. A child is diagnosed with Wilms tumor. During assessment, the nurse in charge expects to detect: A. Gross hematuria. B. Dysuria. C. Nausea and vomiting. D. An abdominal mass. Answer: D. The most common sign of Wilms tumor is a painless, palpable abdominal mass, sometimes accompanied by an increase in abdominal girth. Gross hematuria is uncommon, although microscopic hematuria may be present. Dysuria is not associated with Wilms tumor. Nausea and vomiting are rare in children with Wilms tumor.
Thanks for watching. Please comment, like and share.